And it is time now to visit with our friend, Dr. Kevin Kavanaugh. He is a retired physician and founder of Health Watch USA. Morning, Doc.
Good morning, Jack.
You sent me a couple of volumes of stuff. I'm overwhelmed. Where should we start? Page 37, or you want me to skip on up to page 78?
Yeah, probably. Lots been going on, Jack. It's unbelievable.
Every time I went back to my computer last night, there was something new from Kevin. All right, Kevin, you're on, buddy. What's the most important thing we need to talk about this morning?
Well, the most important thing, Jack, is that last week we talked about dangers over in Europe. Apparently, they're here in the United States too. The variant, which is called the BQ.1.1, and believe me, this is just one of a number of variants in the variant soup, which is growing in the United States. This variant is really the most concerning, and it is the great-grandson of the BA.5. That's what the bivalent booster's for, so hopefully that will have some effect. This variant appears to be evading almost all, if not all, of the monoclonal antibody therapies, including Evusheld, which is used for people who are very high risk as a prophylaxis. In other words, if you had an organ transplant or you're immunosuppressed. And it is growing fast. It is doubling every week, and it has been in the United States for at least 6 weeks, according to CDC data. Now, the CDC had this in the BA.5 category, so it was kind of hiding in plain sight. And just in the last week or so that it became apparent that this in itself is a separate variant. Shouldn't be really considered part of BA.5, but a separate offspring that's wreaking havoc. And so now when you go to the CDC data site, you can see for the past 6 weeks how this thing is progressively growing. And it has doubled over last week, and it's currently over 5% of the isolated variants. Now, what's really disconcerting is people are not getting the vaccine or the bivalent booster. And the booster is key because this bivalent booster is based on BA.5. If anything we've got in our arsenal, that's the weapon that is most likely to crush this thing. Nationally, only about 4.5% of the population has gotten this booster. And I mean, for it to be effective, I would suggest getting it this week. Unfortunately, there is also, of course, on the internet, all of what I would consider misinformation or at least misinterpretation of data regarding risks of getting a booster, getting a vaccination. Believe me, risks are much, much less in the vast majority of individuals than getting COVID-19. That is just key. There's a recent study from the Department of Health down in Florida that's being spread around by the anti-vaxxers that I think is really misinterpreting the data. That study found an 84% increase in heart problems in people age 20 to 39. And, well, that's over normal. They don't have much heart problems to begin with. So that's a very small number. And when compared to the 7 to 11 times increase in cardiac problems if you get this infection, that's a small number. And plus you've got all the other problems of long COVID and problems with kidneys, diabetes, brain fog, etc., that you're avoiding with vaccination. And these can affect the young. In fact, the CDC data shows that long COVID looks like it has a higher incidence in the young than in the elderly. And that may be because the young isn't as highly vaccinated as the elderly. So all of this is, I think very problematic. I should note that the advisements out of Florida are based upon a high level of global immunity to COVID-19. Sorry, herd immunity's out the window. Europe is starting to get crushed by this variant. They have the BQ.1 as one of their variants, and that's the mother and father of this BQ.1.1 variant. And the Hospital Association, for example, in Germany has just asked their government to impose a indoor mask mandate for their entire country because their hospitals are filling and it's becoming a critical level of concern. And so, Jack, we need to act. If I was the governor, I would really get out there on the bullhorn and sound the alarm and for people to go out and get vaccinated. We have the tools. We're just keeping our head in the sand and not doing what we need to do to keep ourselves safe and to keep our community safe. So, Jack, this is a significant problem. So I'll turn the floor back over to you. Sorry about talking so much.
No. I that's exactly why you're on. Why is it such a tough sell, in your opinion, to get people to get this this shot?
I think it's the disinformation. When you have stuff from Florida coming out and saying, well, we found an 84% increase in the incidence of cardiac-related deaths among males 18 to 39. We don't recommend that they get the vaccine because of the high level of global immunity. That puts people in a conundrum. They don't understand this. But I'm sorry, cardiac deaths 18 to 39 in males, pretty rare. So you're talking about a rare incidence of problems. And they say, well, with the level of global immunity, well, that doesn't exist. I mean, this is the old herd immunity thing. Sure, if we had a high level of global immunity where people weren't getting COVID, people probably wouldn't get the vaccine. But that doesn't exist. Germany's getting crushed. And young people do get long COVID. And Jack, there's been a recent study out from Scotland which shows that long COVID is prevalent in up to 50%. There's another out of Germany which has this figure pegged at about 28-30%. So it's a common phenomenon. And the really frustrating thing is that vaccinations help. They can almost half your chances of getting long COVID, and people aren't getting vaccinated. And Jack, long COVID is impacting our workforce. I believe it's the reason why we have such a low unemployment. It's not because the jobs are filled, it's because there's a lot of people that can't work. And the study out of Scotland really showed that if you get long COVID and you've got these symptoms at 6 months, chances are you're going to have the symptoms at 18 months and keep them. And getting reinfected will build on your chances of getting long COVID, and they'll also build on the damage and symptoms you're having from long COVID. We're still learning about this disease, but Jack, what we're seeing isn't good. And unfortunately, people aren't using the tools to prevent it. Wear a mask when you go indoors. Use curbside pickup if you possibly can. Businesses should be increasing their ventilation and installing germicidal UVC type of units up in the ceilings to help reduce respiratory pathogens. And above all, let's get this bivalent BA.5 vaccine. If we have a wave and get crushed by this, it's not the virus's fault, it's not Fauci's fault, it's nobody's fault, but our public for not going out and utilizing the tools and the knowledge that we have. This is extremely important to do.
Dr. Kevin Cavanaugh, thank you, sir.
Thank you, Jack.